Hi everyone, my name is Peter Prescott. Betty Ford invited me to come September 2010 and start a chronic pain track. I thought I'd take some time to explain why, the things we do and how things are going. Chronic pain in the general population affects about 25% of people. Addicts and alcoholics, it's as much as 60 to 80%. And the reason that is people not only experience pain in their body, they also experience emotional pain. So the track that we actually have is designed to treat all types of pain. As I said, it started in September. We had our first class that actually graduated 45 days afterwards. The track is designed because recent studies have shown that chronic pain is a disease of the brain. So we've kind of changed what we do from what's been going on for probably the last 50 years, in that instead of looking at the place that it hurts, we actually look at how pain has changed that person. And how we do that is we meet the patient when they come in, we evaluate them, and we have them do a series of tests that we can actually see how pain has changed them. Many of the patients we have also have emotional pain, and I would assert that 100% of people who come in to this program have emotional pain, but not all of them come into the pain track. So when you're experiencing pain, when you're experiencing the other things that bring you in here, it changes how your brain works. And how it does that is it changes attention, it changes the ability to plan, it changes the things you think about in general, but more importantly, it changes how you think about you as a person, the things you can do, and how you relate to all the people around you, especially your family and loved ones. So the ability to handle pain is something that we're equipped with, but over time, when you experience certain events in the past that can be traumatic, or you put yourself in a situation where there's a lot of stress, the ability to handle that breaks down. And the person gets to the point where they can no longer handle life and cope with stressors. Those are the things we handle in the chronic pain track. The chronic pain track has 4 parts. The first part, there's a group that goes for about an hour and 15 minutes, Monday through Friday. In the group, we try to assess how pain has changed a person. So how it's changed how you think about yourself, how you relate to others, how you relate to people in your family and friends. And most importantly, how it makes you feel inside. So that the internal feeling or the internal milieu that most people don't even check or really understand, we insist on day one that you really start to check that and really start to understand how that has changed and how that can be changed back. We also teach skills in how you judge yourself versus how you judge people you know or relate to. Many people in chronic pain are very harsh on themselves, so that they have very high standards for themselves and don't use the same standards they use for people they know. Another important aspect is coping skills. Most of the coping skills that brought you in here, especially with chronic pain, emotional pain, physical pain, spiritual pain, there have been things that you have experienced in life in the past or presently experiencing, and coming in here using drugs and alcohol that have caused you not to be able to cope with stress. So people who come in here are in a state of chronic stress. And when you're in a state of chronic stress, it changes your brain dramatically. So we evaluate that very early on, get people to understand that they're under chronic stress. And when you're under chronic stress, you can't think as you should. So that the sort of reflective thought processes that people should go through in order to accomplish planning, in order to handle life, have changed to more thought processes that we call reflexive. And when you have reflexive thought processes, what basically happens is when something occurs, you do the easiest thing that you can to try and escape. But that isn't always the best thing you can do to try and help yourself to accomplish tasks and stay on tasks. The second component of the pain group is movement. We've taken portions of Tai Chi, Qigong, Kung Fu, and we put them into about a 45-minute planned movement portion. So some of it is static stances where we stand in place and just try to bring our mind to the present state and to start to investigate how we feel inside. Are we anxious? Is there thoughts that are going on that we can't control? Then we do a series of planned movement where you have to move your hands and legs and have stances very precisely in place so that it takes the attention away from all of the bad things that you're thinking about and brings it into the present. It also teaches people who have been in pain and haven't been moving well how to move in a pain-free, very slow, deliberate manner. The third component of the pain program is mindfulness. We come down in this room we're in now, and we do mindfulness that lasts for about 45 minutes. It's me who usually does it. I bring them through a whole series of exercises that starts out with what's called the art of introspection. Introspection simply means that you have the ability to sit quietly and check out what's going on inside, what's going on in your mind, what's going on inside of your body. Most people who come in here are very anxious. They're having a lot of shame. They're having a lot of thoughts and feelings that they don't have control of. So if you couch that in signal versus noise, the signal is very down, the noise is very high. Before you can change that ratio, you have to have a good understanding of what you have to change. So the introspection part of it gives you the ability to just feel what's going on inside and what's bothering you. It may be emotions, it may be just anxiety, it may be just that your attention is focused on feelings inside that just don't feel well. The next thing we do is just add breathing, very slow, controlled, thoracic breathing, where the attention can go from those things inside that don't feel well onto just simply breathing. And I start people out with a very slow breathing to the count of 4, where they raise their chest up and diaphragm down, they hold their breath, and then they let their breath out. If people practice that every day, that they can learn the art of actually relaxing themselves, and they can learn the art of taking the attention away from being controlled by internal thoughts that they don't have control over to actually gaining control. And when there's periods of stress, when there's periods of inability to sleep, when anxiety comes, it's a good simple tool that they can use early on. Next part of the mindfulness is a Qigong exercise where people systematically go through every part of their bodies. So they start at the top of their head, feel what's going on there, and do a complete evaluation of each area. After they do each evaluation, they take a breath, let the breath out, and then let those areas relax. It goes from the top of the head all the way down to the end of the toes. Next week we do a brief relaxation technique where they close their eyes and take themselves on a trip to a very safe place. and meet something or someone from the past who may be important. This is based on the fact that when the mind is very relaxed, it will go to a place where it needs to heal, so that it gives them the opportunity, after having gone through 40 minutes of relaxing, to actually be able to go to a place that is unresolved and that they need to actually heal. In addition, we have 3 people who do treatments. Acupuncturist Gail McGuire does acupuncture on every person once a week. I do manual treatment called external Qigong, and I have a colleague named Neil Vincent who is trained in acupuncture and acupressure, and he helps. And what we do is we find places in the body where people are holding emotions or trauma, and we help them to release those. The program is 45 days, but some people choose to stay for less or more. And so far we've had about 110 to 115 patients who have come through. One of the great things is it's not only people in chronic pain, as I say, it's people with emotional pain and trauma. We've actually had about 15 people who have been here, relapse, and come back, and we were able to address some of the things that they had missed the first time through, and most of those are emotional problems that had not been resolved, some for many years, some that went back as far as childhood. The whole program is called Neurocognitive Enhancement. It's based upon the fact that when things aren't going well, when cognitive skills aren't well, emotional skills aren't well, and life isn't going well, there's areas in the brain that aren't doing what they should. And with chronic pain and with chemical dependency, it's been shown that very important areas of the brain don't work as they should. So what we do is we target those areas specifically. We do very specific treatments that will re-enhance those areas so that they can work again as they should. The whole concept is called neuroplasticity, so that when you do very targeted treatments on areas of the brain that do certain things, you can get them to reestablish themselves and rework and start to do the things that they should do. One of the things that we try to do also is teach each individual who comes in the Pain Track skills, so that they have skills that they can take home and continue to practice. We think that those are the most important things so far. So that gives you kind of a brief overview of how the Pain Track works.